You're watching Medical News Network, your trusted source for the latest in medical news and information. I'm Mike Wittgenstein, and thanks for joining us. We're very pleased to have in studio an internationally recognized lecturer, author, and educator in the treatment and cure of sleep apnea and TMJ. So if you snore, toss and turn at night, are always fatigued or tired, have chronic neck or shoulder pain, have a child who's undersized, still wets the bed, has difficulty focusing, or has even been diagnosed with ADD, then you don't want to miss what our guest has to say. So stick around. We'll be right back.
Welcome to an educational and comprehensive discussion with today's top medical experts. Your trusted source for the latest in medical news and information. You're watching Medical News Network.
Welcome back. Our guest today is Dr. Brock Rondeau. Dr. Rondeau is a member of the American Academy of Dental Sleep Medicine, a diplomat of the International Board of Orthodontics, and a diplomat of the American Academy of Craniofacial Pain, a small and select group of dental professionals specializing in the treatment and cure of sleep apnea and TMJ. Dr. Rondeau's practice in London, Ontario, is recognized by patients and peers alike as a cutting-edge facility in the care and cure of these disorders. Dr. Rondeau, welcome to the show.
Thanks, Mike. It's nice to be here. Thanks for inviting me.
All right, I brought you on today to talk about sleep apnea and TMJ. But before we get into that, give me a little bit about your background, your history. Now, you teach all over the world dental professionals how to care for these disorders. Tell me how you got into that.
Well, I guess I'm a general dentist, first of all. I've been a general dentist for a long time. You can tell that from the gray hair. And basically, I started wanting to help children that I saw that had malocclusions. That means bad bites.
Okay.
Children with bad bites.
Overbites, underbites?
Overbites, underbites, receded jaws, whatever. And so I started treating these kids and getting very fulfilled because I would significantly improve the profiles. And later on in the program, I'll show you some before and afters that I've done. Really impressive, I think, how you can change the facial profiles of these young kids.
Is it easier to treat at an early age? I mean, can you catch it early?
Oh, much easier.
All right, so you started to help the children, and what happened from there?
Well, 90% of the children's faces develop by age 12. So if you want to guide the growth of your younger patients, you have to go in early. Now,
do you think, I don't mean to interrupt you, but do you think most parents realize that if they get involved, if they catch this at an early age, they can have such a tremendous effect on their child's life as an adult?
No, I think the dental profession hasn't done a very good job of letting patients know that. And there's been no TV programs, there's been no radio programs on this, and really, that's one of the reasons I was glad you brought me on today to try and enlighten parents as to what kind of treatment they could get for their kids so they could prevent problems later on.
Okay, so you started by treating the kids, and we're going to get into that a little bit. And then how did you transition over into helping the adults?
Well, I started using functional appliances on these children. And these little functional appliances would move the jaw forward.
Okay.
And make their profiles look better. And I would also open up their airway when I brought their jaw forward. And so the kids would breathe better, and they would do better in school and everything else. And then what happened, I had a number of parents say to me, I have headaches, and you got rid of my little girl's headaches. Could you do the same for me? And the number one symptom of TMD is headaches.
Okay. Sleep apnea, the same thing? I mean, basically, what is sleep apnea? Let's just start with that right now. Okay. What is sleep apnea?
Sleep apnea is when a patient stops breathing for 10 seconds or more. Now, what happens is they stop breathing for 10 seconds or more, maybe several hundred times a night. And that blocks the airway, and that reduces the amount of oxygen the patient gets, and then they have an arousal, and they wake up. And they wake up several times a night, and that really makes them very fatigued the next day. When you wake up all night long, you're not getting a very good sleep.
So you're tired, you're listless, but you said in children, you notice the exact opposite.
That's right. What's really funny what's really interesting is that the children they don't get fatigued, they get hyper. And they get a condition called attention deficit disorder, which is ADD. And then they're hard to handle because they're aggressive and they're excitable and they're hard to handle in school. So they tell the teachers tell the parents, what are we going to do with these children? I can't control them. So the medical doctors then put them on medication Ritalin, which is a stimulant. You wouldn't
Right.
think a stimulant would calm people down, but it calms the children down.
Because it's doing the exact opposite of what not having the oxygen is really doing to them. Now, I don't mean to put you on the spot, but I've had some discussions with you, and I know that you have taken children that have ADD, that are on Ritalin, that you've put in the appliance, that you've worked with them, and you've actually, they most times are able to come off the medicine.
Absolutely. I mean, you can give them a new drug. It's called oxygen.
Now, tell me about that, because we're going to show a video clip you brought of what sleep apnea is. And I talk to you about every now and then my kids tend to breathe heavy. You know, my kids are good size, but they tend to breathe heavy, and every now and then they snore. And you said that that's not something.
No, snoring is bad. Snoring, it means there's an obstruction in the airway. If you have an obstruction in the airway, then you're getting less oxygen than you're supposed to get, and you get all kinds of other symptoms. So the main problem of children that snore, they have large adenoids and tonsils. So they need to go to a dentist that has a potential to take an x-ray, cephalometric film of the side of the head, and check to see whether or not their tonsils and adenoids are enlarged. If they are enlarged.
When I was a child, almost everybody got their tonsils out. If you got the flu, your tonsils swole up, they chopped them out. Today, it doesn't seem like anybody wants to take them out. So they sit in the back of the throat, and you're saying that they swell up, and then the kids can't breathe.
That's right.
And then the adenoids you can't really see.
That's right.
They're up behind, but they swell up. Okay. So opening up the airway allows the oxygen to get in.
Right.
And then not having that oxygen in the child causes them to become hyperactive, you said?
Hyperactive.
Not be able to focus?
Not be able to focus
Now,
in
you
school.
said still wet the bed.
Yeah, they still wet the bed.
Why would not breathing cause them to do that?
The lack of oxygen causes that problem.
All right. Well, let's take a quick look at the video clip so everybody can understand really what sleep apnea is.
Okay.
So let's roll the clip. Tell me what's going on here. So here's a lady that's just sleeping. Snoring?
Snoring now, yeah.
All right. No big deal. Everybody snores a little bit. But then she seems to stop and lock up. So what happens in the throat?
What happens is when they lie on their back, particularly, their tongue falls back. And you see there's the tongue fell back, but there's a little space, so it's snoring. And when the tongue completely blocks the airway, it's apnea.
Okay. Now, when you have apnea, when the tongue completely blocks the airway, you say they wake up, but they don't remember it.
That's right. Anytime your oxygen level goes down below 90%, then you have a problem, because then the body says we're not getting enough oxygen, and so the brain gives a message to the lungs to start breathing again, and that wakes the patient up.
Because otherwise they'd suffocate.
It's called an arousal.
Okay, how does that, I mean, they still sleep all night. I mean, they're in bed 8 hours or 10 hours. How does that translate into them feeling tired or fatigued the next morning? I mean, they still were in bed for 8 hours sleeping, right?
They have the partial wake-ups called
Okay.
arousals, maybe 50 times an hour. And then they're exhausted when they wake up. I always ask my patients, do you feel refreshed when you wake up? Are you tired during the day? That's the #1 symptom of sleep apnea.
Fall asleep at the movies or at the stoplight in the car? Or
That's
warm,
a severe case.
falling asleep in front of the TV?
Yes.
Just tired, listless?
Yeah.
Now, you told me that because of the apneic events, they don't ever get into what we've heard called REM sleep.
That's correct.
And what happens in your body during REM sleep that's so important?
You dream, and your body totally relaxes. So the patient's not dreaming. That's a very good sign that they may have sleep apnea. But also your spouse is the one that's really got to tell you if you have it, because your spouse will be upset because you stop breathing.
Right.
And they're concerned that you've stopped breathing, and they think you're going to die. And you will die unless the brain wakes you up and you have this arousal and start breathing again.
Okay. I want to know, we're going to get into why you think people don't pursue treatment more. I know why I think. We have to take a quick break. When we come back, we're going to talk a little bit about the CPAP. We're going to talk a little bit more about oral appliances that can cure this, and a little bit more about what people really need to know to understand how big a problem this is. How many people did you tell me TMJ and sleep apnea in North America?
Well, in North America, 90 million people suffer from insomnia, which is inability to sleep, snoring, and sleep apnea. 90 million people. That's almost a third of the population.
And of those treatment options, you don't ever really see, I mean, we see signs, don't let friends drive drunk. We don't see signs that say don't let friends drive sleepy. And getting ready to come talk to you, I have a lot of